MEC, thank you so much for your time and a very warm good morning to you. Now, please take us through, of course, this decision to move all screening and testing now to accommodate all vulnerable groups. I understand these include the elderly, of course, as well as those who have underlying medical conditions.
Yeah, I think it's a good morning to your viewers. I think it's one of the considerations that we had to make in order for us to be able to protect particularly the group that is a vulnerable one, and those who are at actually high risk. Having seen that the number of people who had a severe course of disease are those who have been the elderly and also who had the comorbidities. So now we have opened up so that we can also see the prevalence of the disease in our population, because we are also going to be testing all people and all patients that are entering our facilities.
Yeah, and just for clarity's sake, this include even those that don't necessarily show symptoms of COVID-19?
Yes, I think the screening will still remain in terms of the tool that we use, but now we are going to be very sensitive to those who have got comorbidities like your hypertension, TB, and your asthma, and all those who are elderly. It's also just for us to be able to get those who will present without any symptoms.
Right. But on a separate case, MEC, I mean, if I have my stats correctly here, over 1.7 million people in Gauteng have been screened so far. Over 25,000 people in Gauteng have also been tested. But also the Premier, David Makhura, had committed that by July 2020, the target would have been to screen and test 5 million residents in Gauteng. Are you well within that reach and that commitment?
We will be able to reach that commitment and even surpass it by far, because actual screening will be even also happening in our retail sector, where we have our malls. We're going to, we had a discussion with the owners of the malls and the shopping centers, where we're going to be putting up testing stations and testing desks around, the shopping malls. And also because we also have a greater focus on our correctional service facilities, and we are sure that we are going to surpass that. And we have been able to procure as much as possible the test kits, and we have a number of support that we are getting from the private sector and the NGO sector, who are going to help us present.
All right, we seem to have lost MEC Bandile Masuku there. Apologies for that technical glitch. He was just still explaining, of course, that 5 million target with which David Makhura, the Premier, had, of course, said they had set for themselves for July. MEC, if you're back with me, we apologize for that inconvenience and technical glitch there. But you were still explaining to us that you were receiving the necessary support from various organizations to, in fact, surpass that 5 million target.
Yes, I think we have created a network of different NGOs and different private laboratories, which will help us to even get a much faster turnaround in terms of the results, and also to attend the outbreaks and our hotspots. Our hotspots here, we're actually focusing on our shopping centers and shopping malls that we find around Gauteng, and we are going to be having testing stations in most of them.
Yeah, I want to get into the hotspots in Gauteng in just a moment, but before I do, just on the issue of reaching that target and ensuring an effective screening and testing process, I mean, I suppose part of that will be to continue with your contact tracing, and so far I understand that you have over 8,000 people that you have contact traced. This means that people that have been screened, who have told you who they've been in touch with, perhaps who had been also tested positive for COVID-19. How has that process particularly been going in Gauteng?
It has improved so much since we started in March. You would realize, I think the first time when we reported, we were almost at 56% in terms of our contact tracing. But in the past month or so, since the beginning of April, we've been actually tracing around 98% and 99%. In some instances, we get to a point where we do 100% in a very short space of time. And we know that contact tracing is one of the ways on how we can be able to get, the disease spread, to contain it.
Are there any plans perhaps to even screen and test those who are queuing, getting their grants? This could be different beneficiaries from the elderly, people living with disability, I suppose even mothers who are there to receive their children's grants. Some have even said that they don't know their status at this point.
Yes, I think in some of the shopping centres we are going to start tomorrow to do that. But remember, we only had the meeting and some form of an agreement from the shopping centre owners and shopping malls owners to give us space in their property where we can be able to do this. But we have been able to do a whole round of our testing and screening in our mental health care users in facilities, and we also have been doing that with our elderly. Over and above that, we have been giving them flu shots to make sure that they are prevented to get a severe form of flu actually going forward.
Right. And before I let you go, MEC, I need to talk about those hospitals that you made mention of earlier on. I mean, according to your statement here, Johannesburg is now standing at 954 cases, Ekurhuleni at 360, but also Tshwane, they're showing 211, confirmed cases so far. Now, the Minister of Health, that's Dr. Willem Kiese, has not made it a secret that we can expect, of course, those numbers to spike, particularly also because we're getting into a winter season soon. But with Gauteng as a province, what plans do you have to ensure those numbers do not spike up drastically and rapidly?
I think the whole matter is about our testing drive that we're going to have. And when you look at those figures, we do have now actually released, recoveries. You'll find that even the active cases that we have, in the 1,600 infected cases, we're only tracing and looking after, 34% of those. So there is a great number of those who have recovered and a very small number of the active cases, which gives us actually some form of solace. So if we can be able to increase our numbers of those who are actually recovering, then it will make it easy for us to be able to cope with any of the number of the active cases.
MEC for Health in the Department of Gauteng, Dr. Bandile Masuku, thank you so much for joining us this morning.